Okay, today we're going to talk about the skull. Okay, the skull is an important component of the skeletal system because it is one of the structures that protects the brain aside from the meninges. Okay, so it's important to note that in terms of the bones of the skull, okay, you have different types of bones. The bone that is enclosing the brain is called the cranium, and of course you have your facial bones here. Now let's deal first with the facial bones. With regard to the facial bones, as you can clearly see, you have here, first you have your mandible. Okay? And the mandible, as you can clearly see, is essentially found in the part of the lower portion of the face. The second bone is called the maxilla. Maxilla here, maxilla there. Okay? And of course your nasal bone. The nasal bone is there, and the base of the nasal bone here is called the vomer. Okay, the vomer is there in the base of the nasal septum, which separates the nasal cavity on the left and the right. What do you call the cheekbone? Essentially, the cheekbone is nothing else but is also known as the zygomatic bone. So, what's another name for a cheekbone? A zygomatic bone. Okay, so the zygomatic bone is the cheekbone. This is called the maxilla. The lower part here is called the mandible. And of course, you have here the nasal bone, and the bone is called the vomer that you find here. Okay? Now, with regard to the bone of the skull, the bone of the skull includes your what? The bone in front, called the, as easily remember, the frontal bone. What about behind the frontal bone is your what? It's called the parietal bone. What about the bone at the back? Occipital bone. Right? It's called the what? Occipital bone. Observe that the parietal bone is separated from the frontal bone by this coronal suture. On the other hand, the left parietal bone and the right parietal bone are separated by the sagittal suture. What about the parietal bone and the occipital bone? There is a suture called the lambdoid suture. Okay, so you notice this is a suture here that you find here. Lambdoid, sagittal, and the one here is called what? The coronal sutures. Okay? So again, these are parts of the cranium and parts of the facial bone. Now, so let me just reiterate the importance of the sutures. So you have your coronal suture, sagittal suture, and the lambdoid suture. At the same time, if you open up the skull, you see that there is a bone that resembles the wing of a bat. It's called the sphenoid bone. Now, this sphenoid bone contains the cellula turcica, which is important because it is where you have the pituitary gland. The cellula turcica, which contains the hypophyseal fossa. Hypophysis is another name for the pituitary gland. Now, this bone that resembles the wing of the bat is what again? The sphenoid bone. Okay? And what do you call the bone here in the side? In the temple, it's called the temporal bone. So first it's called the frontal bone, parietal bone, occipital bone at the back, and then the one here is called temporal bone. If you open the skull, inside you have the sphenoid bone. Observe too that inside you have the anterior cranial fossa. What does the word fossa mean? A space. Okay? Anterior cranial fossa, then you have your middle cranial fossa, and the posterior cranial fossa, which obviously is where you have your brain tissue in these areas or spaces. Now there is a big opening here, and this big opening is called what? The foramen magnum. Okay? So this foramen magnum is where the spinal cord will pass through. Okay? And that's important because it comes out from the brain itself. Okay? So these are the parts of the skull. As we said, the skull is made up of the cranium and of course the facial bones. Okay? So that's for the skull, the cranium, and the facial bones for today's lecture on the skull. Okay?